Okay, so we are in the helicopter on our way to Texas Children's, which is a 2-hour drive, so it's really only like a 15-minute helicopter flight. And I know the flight medic very well. I work with him. He is absolutely incredible. I was just very happy that he was there. He was let me be very involved, which was amazing because I needed that so bad. I needed to have something to do. Because if not, I would have lost it. I didn't realize it at the time, but the reason that I needed to be so busy was because I wasn't coping. I wasn't accepting the situation for what it was. I wasn't letting myself feel the pain. I went into work mode instead of letting myself be a mom and hurt for her. And yes, at this point, someone did give me a shirt, so I'm no longer running around naked. Yay, me. While we are in the air, she stops breathing again, and her heart rate starts to plummet. But they were able to give her some stimulants and stimulate her enough to get it back up to normal. We get to the hospital, and of course, they're, running around, running 2 million tests. They're doing spinal taps. They're doing all these different things. Guys, I was so numb at this point and had pushed all my feelings down so deep that when they did a spinal tap, I sat there and watched and listened to my daughter scream and didn't flinch. Not only that, I saw the spinal fluid come out milky, 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 which is very bad. Everyone automatically assumed that she had meningitis and went into that protocol and started giving different medications or IV fluids and putting us in isolation so we could figure out whether it was bacterial or viral or the fact if we even had it. And I'm just chilling like I'm at work. You guys, what is wrong with me? Like, I had zero emotion. And I'm just not there. I am not taking in, I'm not processing what was happening. To me, I was still at home holding my baby. So it was really hard. My husband is, poor guy. He couldn't even go with her in the helicopter. I can't imagine how hard that was for him. But he winds up coming down to Houston and getting a hotel room across the street. He's got me a bag full of stuff. You guys, I'm still like bleeding from being postpartum. Like, I have nothing. I don't have a phone charger. My phone's at 3%. It was really, really, really hectic and really crazy, but he was able to get me a bag of stuff into the hospital. I totally have to brag on my husband. I didn't even have to ask him to bring me a bag, and he thought of everything, you guys. Every single last thing that I could have needed in that hospital was in there. Food, toothbrush, soap, deodorant, peri pads, extra clothes, nail files, because he knew I was going to be chewing all my nails off, hairbrush, like, every single thing I could have ever needed. Ibuprofen was there. My depression medication, because I still had postpartum depression from my first pregnancy. He's so amazing. He is my rock, and I could not have made it through this without him. So that I could at least, shower and not be disgusting and charge my phone, have something to eat other than crackers and orange juice that they give you at the hospital. They admit her back to the same floor, the NICU. She's got the same nurses she had the first time, which initially I thought was fantastic. She initially had the same doctor, and I was super excited about that because they already knew her history, they knew what was going on, and I just felt like she would get great care. I was wrong. I was very wrong. There were a lot of things that didn't sit well with me, like the fact that I know my daughter was not the sickest child in the NICU, but my daughter was very sick. And they continued to give us float nurses instead of nurses that she's had previously, or generally work in the NICU. These are nurses that work with older kids. Like there's a big difference between a newborn and an older child. But that was just one of the red flags that I had. Another red flag was that no one told us that I could have actually left until we were like 2 or 3 days into it, which was really irritating. But once we did find out that I could leave, my husband came down every single day, brought me new supplies, took my dirty clothes, and took me out to dinner so that we could just spend some time together and talk about what everything was going on. And he always brought my daughter so that I could see her and spend time with her, because I was already missing her so much. You guys, he really is absolutely incredible. Absolutely incredible. But for the fact that they didn't tell us that, it just blows my mind. There's so many things that weren't right. Once the shift started changing, it was bad. They had her on the monitors, all this other stuff. They couldn't tell me why. She was septic at this point, so they're running all sorts of labs and cultures and everything they can possibly do to try to figure out what the hell it is. But my doctor is set 100% in his way that she caught something like a virus, or hand, foot, mouth was one of them that he said. Little insert here, the results came back from the spinal tap and were negative for both forms of meningitis, but they did say she had a lot of white blood cells in there, which basically means that she has an infection and they don't know what it is. And my doctor was 100% set on the fact that that is the only reason, the only possibility in any way, shape, or form that my daughter went into cardiac arrest that caused this to happen. No. Okay, that's not what caused my daughter to go into cardiac arrest. Oh, and by the way, I don't know about y'all, but if anyone goes into cardiac arrest, I think a cardiologist would be a very important person to bring in, and it would also be very important to get an EKG to see if there's any dysrhythmias or anything wrong with the heart, maybe an echo. They refused to give me a cardiologist. It's empty, baby. There's no juice in there. You want more? Okay, I will go get you more. They refused to give me a cardiologist or bring one in. They refused to do an echo on her. They did a 12 lead, but wouldn't let me see it, which is fucking bullshit. Ugh, that's disgusting. Mac and cheese and water, yummy. Anyways, I also repeatedly asked for a neurologist because of the hypothermia and the shivering that she was constantly doing. Like that's not normal. She had continuous episodes where she would stop breathing and her heart rate would plummet in the NICU. They were doing nothing, and they kept telling me, stop stimulating her, let her be. She will respond on her own. And I'm like, her oxygen saturations are 86. Her oxygen saturations were regularly dropping down to 86. Her heart rate was dropping below 90. And I don't know if any of y'all have any medical knowledge, especially about pediatrics. Shh, baby. But the younger the child or the infant, the higher the heart rate should be. And in infants, you can get away with oxygen saturations down to like 84, but that's still borderline, and that's a sick baby that's doing that, okay? My child was doing this regularly, and my child's heart rate was below that of an average adult. This is not right. There's something wrong, very, very wrong. And they're still refusing to give me a cardiology team or a cardiologist to come in. They are anytime, so the alarms go off through the entire floor when their vitals drop below the parameters of whatever they have them set for. Yes, baby. And her alarms kept going off, and then here they just come strolling down the hallway with not a care in the world. And I'm stimulating her, I'm picking her up, I'm doing everything I can. They stick their head in and they're like, hey, you good? I'm pretty sure you're getting paid right now and I'm not. Come in here and do your damn job. I mean, I work in emergency medicine, but I don't specialize in children. I'm not perfect. Not only that, I'm extremely distraught and emotional because this is my baby. I can make a mistake, so why won't you do your own job? At this point, I knew I was done with that hospital. They were not going to give respectable care to my child, and I wanted to be discharged, and I wanted to get the hell out of there and get her somewhere that I knew that they would take care of her. I mean, we pulled patient advocate, I called offices, like I was getting nowhere, absolutely nowhere. Yes, dear, I know, I see you. Sorry, trying to get her water, that's what I needed. Anyways, I'm completely done. I don't want to see them, I don't want to talk to them. They wind up discharging us, and I immediately go to my pediatrician and I said, I want to see a cardiologist now. And she said, okay. So off we go 2 hours the opposite direction to Austin instead of Houston, where the Dell Children's Hospital is. First thing they do when the cardiologist, first of all, we call the cardiologist because she's not admitted to the hospital, so this is all outpatient. I tell them what's going on, and they said, come now, we will fit you in no matter when you get here. We will stay until after 5, we will see your daughter. That is the care you're supposed to give. That is the care I expect every medical professional, whether it's me or someone else, to give to a patient. Okay, I know that kind of sounds ridiculous, but when you're talking about an infant, a newborn with massive issues, you don't say, oh, we'll wait till Monday. You don't do that. If you do that, you don't have a fucking heart. You shouldn't be in the medical field, and you need to just go on, because it's crap. That's not normal. Okay, not normal. Anyways, oh crap, I forgot to tell y'all. When we did get her home, the first thing that I do is I put ears on her. I listened with the stethoscope, and I hear a massive murmur. Okay, I am not a cardiologist. I love working with pediatric children, but I don't specialize in them. I worked in peds before I got on an ambulance as a nurse's assistant. But there's a small little bit of information. My mother was a pediatric nurse for like 26 years before moving to a different department. She was incredible, and she was the go-to nurse that everybody loved, and everyone knew when there was questions, when they didn't know what to do, they went to her. That is where my love for pediatrics grew, and that is how I have so much basic information or knowledge on pediatrics. Okay, I learned most of this from my mother. I've done some pediatric training, but my mom is a genius when it comes to pediatrics. That being said, I let my mom listen to my daughter. My mom's like, oh wow, that's really not good. How did they not tell you? How did they not know? It's so obvious. So we were thinking, okay, maybe it's intermittent. Maybe it doesn't happen all the time. And when they just so happened to be listening at that moment, you couldn't hear the dysrhythmias. It was all the time. There was no reason that they should have missed it. It was not my specialty. And I heard it. I heard it. Like, obviously heard it. I was like, this is the most obvious thing on the planet. How can every nurse that walked in their room put ears on her? How did they not hear it? Or did they just so happen to forget to tell me that my daughter has a fucking heart murmur and then refuse to give me a cardiologist? Now, yes, I understand a lot of babies are born with murmurs. It's normal, and they tend to go away on their own. But my daughter is not normal. It's not normal to go into cardiac arrest. There's something else wrong, and something needs to be done. Anyways, we get her to the cardiologist. They hear the murmur. They're like, oh my God, this is really bad. They do an echo, they do EKGs and do a bunch of lab work, and she has a PFO. I'm going to try to explain a PFO as well as I can, but it's a very complicated process that goes on inside of the baby. So when the baby is in utero, mama feeds the baby oxygenated blood through the umbilical cord. Therefore, the blood does not need to go through the lungs in the infant, the baby, to get oxygen. So it bypasses the lungs with a hole called a PFO. Okay, and this whole beautiful thing happens when the baby takes its first breath after it's born and stops receiving blood from mom, where the whole system moves over and pipes start working, and pipes meaning blood vessels, where the blood now actually starts going through the lungs and no longer bypasses it to get oxygen. And that PFO, that hole, is supposed to close on its own, and normally does. My daughter's did not, and it's much larger than the normal PFO. With that being said, people can live with a PFO all the time because the backflow of blood that happens with this hole still being there, it's already oxygenated blood that's backflowing. So it's not going to cause any cyanosis or low oxygen saturations or anything like that. They can live with it. Most people that have PFOs do. And it will never get worse. It'll only get better. So that's a very, very important, great thing. But yeah, so that's PFO. Her hole did not close, and her hole's like way bigger than it should be. And then on top of that, she's got horrible pulmonary stenosis, which means the pulmonary artery that feeds blood back and forth to the lungs is like narrowed, like really, really, really small, which is a problem. Kids can live with it their entire life and survive. They are not restricted on anything, and neither one of the problems will get worse. They will only get better from where she's at. So hallelujah, like that's amazing, but at least we now know there is something wrong with her. It's not just a stupid virus that these damn doctors want to just blow it off as. Like, there's something wrong. And I knew it. I was so mad. I was so freaking mad. But I still had another feeling, like something else is going on. I don't know what it is, but something else is wrong. Now, the cardiologist did mention that there are a lot of other genetic issues that happen just during the development of the child that have the rectal malformation and the heart problems that she wants to do blood work for and go get some other studies and done to see if they are. So I'm like, I bet you that's it. I bet you there's something else going on. Well, sure enough, we go and do all these studies, and first off, we're traveling back and forth to Austin for all of these. There's no place here in town that will do these studies, and my doctors do not want them done by anybody other than pediatric specialists, because it is very important that they are done correctly, like 100% correctly. Yes, dear. Now, this doctor's office and this whole team is incredible. They are doing everything they can to give us, to accommodate the fact that we live out of town and we're driving back and forth and trying to keep my daughter out of the car seat as much as possible, knowing that my husband or somebody has to come with me because she cannot be in the car seat without being monitored because she'll possibly stop breathing again. So we are having to double team go down there, which means both of us are not working. Someone has to also take off work to watch my other daughter. They're just being incredible, and they're compensating for us so well. I was very impressed and just very happy with the care that they gave me and my family. So we get down there and we're doing ultrasounds and more x-rays of different parts of the body, and they're doing CT scans of the brain and a whole bunch of other, tests to figure stuff out, and things come back not good. She has, her right kidney is enlarged, rotated, and has backflow of urine in it. because of the kidney issues, we need to go see a urologist. So we set up that appointment and come back a few days later. She says there's definitely something wrong and she wants to run some more studies, of course. So we go back and do more studies, and she calls saying she's really concerned that my daughter might have a tethered spinal cord, that we need to do a spinal ultrasound ASAP, and she's got it scheduled for us. So we do that, and she calls us back. Luckily, it was not a tethered spinal cord, which is absolutely amazing because that would have meant neurosurgery, and we were not looking forward to that at all. So that appointment was in late October, and today is now November 11th. We are headed to Austin right now to meet with the general surgeon, who's basically the main surgeon for all the surgeries together, to go over all of the results and hopefully schedule the surgery as soon as possible, or surgeries. We're really going to try and do multiple surgeries all in one, so that she doesn't have to go under anesthesia a whole bunch of times and she only has one recovery. But it's all going to depend on how she's handling the surgery, why they're in the midst of it, and if we can get all the surgeons together at one time anyways. But yeah, we're on our way to Austin, and I will keep y'all updated when I know more.